Hey, how would you like to avoid knee replacement surgery? Today we're going to talk about knee repair, not knee replacement. You got pain in your knee? This is Dr. P, otherwise known as Dr. Mark Petropoli, and today we're going to talk about a system that I developed back in 2020 during COVID called knee repair, not knee replacement, and it's kind of an interesting story. I am an orthopedic surgeon, and I've been trained on many different orthopedic procedures, including knee replacements, and so a knee replacement isn't really cutting the entire knee out. We don't cut the whole bones out and take everything out, but what we do is the surface of the bone, the cartilage on the end of the bone is wearing down, and a lot of times it ends up being bone on bone. So in the past, really the only treatment was either live with it or knee replacement, where we go inside the knee and cut the surfaces off using special guides and then cement or put on metal cap on the end of the thigh bone and a little metal plate with a piece of plastic on the shin bone area, and it's more of a resurfacing, not actually a replacement, but it's called knee replacement. It's actually a very successful surgery in 85% of the people that undergo that surgery, but there's still about a 15% chance it might not go well, and if it doesn't go well, now you're stuck with metal, plastic, cement, and it can be kind of a disaster. So we always have tried to put off that for as long as possible, but then when there was no other choice, that's what we would revert to. And so I used to still perform knee replacements right up until COVID hit, and then the hospitals shut down. So I had a list of, 10 people who were either scheduled for or just about ready to be scheduled for a knee replacement, and the hospitals shut down, and as you all know, we didn't know when they were going to start back up again, so we just couldn't perform surgery on them. So they were like, well, what are you going to do? Is there anything else I can do? And I had been doing PRP, which stands for platelet-rich plasma, and I have plenty of videos on that if you want to click on any of those videos. I've been doing PRP since 2008. I've been doing the bone marrow aspirate cells, or the quote-unquote stem cell injections, since 2017. I have been doing the healing laser treatments since 2017, and we had a thing called VFit. So we have a physical therapy department, but we took that to the next level for patients who really wanted a total body fitness, a medicalized, meaning medical staff who are trained not only in medicine, physical therapy, athletic training services, rehab, but also special certifications in strength and conditioning, fitness, orthopedic sports medicine. And so we developed that program in the early 2000s, and that is more of a medicalized total body fitness program. So we had these options, and none of them required going to the operating room. They all could be done in the office. They all are much lower risk than a knee replacement, much less invasive, and they're biologic treatments which allow you to keep your own parts, which is pretty amazing. And when you really get down to it, most people don't want to have surgery if they don't have to have it. I've had 5 surgeries, I've had knee surgery, and I didn't want to have that surgery if I didn't have to have it either. And for me, I would put off a total knee replacement or avoid it as long as I could as well. Again, not bashing knee replacements, but who wants metal, plastic, and cement, which is last century's technology, if you can keep your own parts and maybe even regrow back part of your parts or repair them? What I talk to these patients about is that, hey, I have all these different things and they all work, but I was never quite satisfied with doing like only PRP or only bone marrow or any of these things by themselves. They worked, but not as well as I would have liked and not as predictable as I would have liked. And so I just started saying, hey, we have all these things, let's just hit you with everything. And they're like, well, what do you mean? And I'm like, well, we're going to do the bone marrow cells, we're going to do the PRP, we're going to do the laser, and we're going to do the total body fitness. Now, my goal was to also get weight loss and nutrition, which we now have, but we didn't have that at the time. So people who have knee replacements, a lot of times they have a problem with the bone, the underlying bone as well. It gets soft. So there was another procedure, a less invasive procedure that I had been doing since 2014, and where I inject artificial calcium phosphate bone paste. I know that's a lot of words, but our bone is made out of calcium and phosphate, and so there's a company that makes a powder. You mix it up with saline or salt water, and in the operating room we would inject that into the bone where the bone was soft, and it would harden up after 10 minutes, and then that bone would be more supportive to the cartilage overlying it, and it would prevent the arthritis from getting worse. So I had a name that I used for that. I would say, well, this is knee repair, not knee replacement. But that was only one part of it. That was just the bone problem. And so that never took care of the underlying cartilage wearing down inside the knee. And so that's where the bone marrow cells, the quote unquote stem cells, the PRP, and the laser came into play to improve the inside of the joint, not just the bone problem. So basically, I started doing these in-office procedures on patients who needed, quote unquote, needed knee replacements. And next thing you know, most of them were avoiding it. And then I had their friends coming who wanted to have it done. So I just started calling the whole brand, I would call it. It's really more of a brand. We try to repair people rather than replace them. And that's kind of our brand. That's kind of what we do. It's not really one distinct procedure or surgery or thing like that. It's really more of our philosophy, our brand. We're going to try to repair you, help you keep your own parts. And there's a lot of different components to that. And that's why we call it knee repair, not knee replacement. And because it was working so well, I didn't have any experience with this, but I'm like, I think I'm going to trademark the name because I've been using it for a while. So I was able to get that name trademarked. Now, people might think, well, does it only work on knees? But no, it works on shoulders. It works on other joints as well. I see a lot of shoulder problems. I see a lot of muscles tears. I see a lot of tendon injuries. So this repair as opposed to replace is a generalized philosophy, and it works for everything, but the trademark is actually knee repair, not knee replacement, and that is by far where we have the most numbers of patients coming in. So that's where that originated from. And again, it's a philosophy, it's a brand. We have lots of different avenues to get you there, and it's not always a one size fits all. Once we figure out what's wrong with the knee, that's great, but then I really want to know what your goals are. We want to know, like, what do you want to do? What are your goals? Do you want to play with the grandkids? Do you want to go on trips and not be in pain? Do you want to be not the slow one when you go for walks? Do you want to go back for walks again? Those are like some of the most common things. I just want to stand without pain. Well, once we know your goals, then we can tailor a specific program that's best for you. It's still knee repair, not knee replacement, but it's not one pigeonhole thing. So it's not really one thing, it's not really four things. It's a whole armamentarium that we have where we can treat the whole body and treat your goals, not necessarily your knee or your injured body part. And that's really what we're trying to do. And some people have a lot higher goals. They want to run again. They want to maybe run a marathon. They want to climb a mountain. Great. You know what? We got a program for you too. We got people who want to lose weight, or maybe they don't want to lose weight, but we're going to tell them, if you don't lose the weight, none of this is going to work. So we're pretty honest with people, and we're very honest with people. But sometimes you have to be that way in order to get them to see, hey, you want to reach this goal? You got to be all in. We're going to be all in to getting you better. We need you to be all in as well. And not everybody can do that, but the people who do reap the rewards. So that's where knee repair, not knee replacement came from. And I hope, if you want to learn more, we have a lot of videos on each specific potential component that can be utilized. Click on some of those videos. Also, if you have comments, please feel free to comment. That's how I got this video, is somebody had a comment and I ended up deciding to make a video. So comment, like us, subscribe, all those things. And remember, if you have a problem with your knee, call Dr. P.